The pro-life movement is preparing for a post-Roe world by establishing a new network called PLAN. PLAN, which stands for the Pregnancy and Life Assistance Network, facilitates collaboration between assistance programs and their communities. The goal is to build an infrastructure that empowers women and families by providing medical, social, and material support. The project, still in its early stages, comes as there's greater anticipation surrounding the possibility Roe v. Wade may soon be overturned. Pro-lifers recognize with the possibility of abortion being illegal in our nation, there will be an even greater need to serve and support pregnant women and their children. The Atlantic publication announced this PLAN project in a piece last week. The Atlantic's Emma Green writes, quote, "In theory, it's an ambitious effort to find common ground between hardcore anti-abortion rights activists and people who want to help pregnant women but may not be convinced that abortion should be completely banned." Joining us now via Skype are two leaders of PLAN. Chaney Mullins is the PLAN Program Manager, and Jill Stanek is the PLAN Community Outreach Manager. She previously worked as a nurse in the Labor and Delivery Department. Thank you both for coming onto the show. Chaney, can you explain what will PLAN do that does not already exist in the pro-life movement?
Thank you, Catherine. The pro-life movement and faith communities have already been faithfully serving women and families for decades, and we want to highlight their excellent work. You can imagine all these service providers as dots, not just the pregnancy centers, but all kinds of charities serving those medical, material, and social needs. And what PLAN is doing is connecting those dots, making a more complete picture so that the providers know about each other and so that the communities and churches can know about the providers and get more involved.
Jill, if and when Roe v. Wade is overturned, are pregnancy centers prepared and ready to care for pregnant women in need?
Catherine, pregnancy centers already outnumber abortion clinics in the U.S. 3-to-1, and federally subsidized health centers outnumber Planned Parenthoods by 20-to-1. So we have a good start, but we must also know that there's 7 primary reasons that moms seek abortions. So we are working to address all of those reasons in addition to pregnancy help and community help.
Jill, as a pro-life leader yourself, how close do you believe we are to overturning Roe v. Wade?
Well, as Marjorie said in that article you mentioned at the beginning of the show, we believe we are coming close to a world where Roe v. Wade is going to be unrecognizable because it has been cut up to such a great extent, or it will be overturned. So we must continue to bulk up the Supreme Court, and that is going to be done if we re-elect our pro-life president and hold on to the Senate. And when Roe is overturned, 30 states stand ready to make abortion immediately illegal or eminently make it illegal. So many in the pro-life movement are hopeful that we're going to be living in a post-Roe America sooner rather than later.
Chaney, from your healthcare background, if and when Roe v. Wade is overturned, what will be the biggest gap when it comes to serving women in need, and how will PLAN play a role in filling that gap?
I would say anecdotally, based on countless conversations with service providers, there's a real gap in terms of housing and pro-life prenatal care. PLAN really hopes to work with the communities, inspiring them and helping them strategize how to fill these gaps. But we know also that needs vary from mother to mother, and that's why PLAN's directory is truly comprehensive, full of life-affirming resources to answer all the reasons why women get abortions. And she might be facing really difficult situations like domestic violence, addiction, or even trafficking. And over 50% of moms that seek abortions already have a child or more at home. And she might be thinking, how can I feed this child and my other kids? We want to help her meet her needs and assuage her fears.
Jill, the abortion issue is incredibly divisive and is a political lightning rod. Is there an opportunity here at PLAN to bring together people who disagree on abortion but do agree on helping women in need?
Absolutely, Catherine. Plan is a non-political initiative, and I can think of two great examples already to answer your question. And one is a church that is part of our extended network that belongs to a pro-abortion denomination, but they really want to help women and be a part of what we do. And then another is a legal center that doesn't take a stand on abortion, but sees a lot of immigrant pregnant mothers, and so is thankful for the resources that we can provide to them and want to be a part of what we do too.
Chaney, the CDC recently released a report that finds Hispanic and non-Hispanic Black pregnant women appear to be disproportionately affected by COVID-19 during pregnancy. How will Plan take minority women's health into consideration and work to curb the disparity in health care that minority women do experience?
Catherine, one reason for this major health disparity is a tragic lack of prenatal care. And as Plan inventories life-affirming doctors who really listen, really care about empowering minority women and partnering with them for the sake of their health, we'll publicize where these women can find these providers, where they can go for free or discount care. And this should drastically improve outcomes for both moms and babies. What we don't want to find is a Planned Parenthood in a minority community, but no life-affirming clinic or option, because we know abortion is the leading cause of death in the Black community. And why is this? We must ask. It's often because minority women don't feel supported. They don't feel like they have enough resources to be a successful mom. And that plan directory will give churches and assistance providers the tools they need to give that woman concrete help.
Jill, what kind of insight can the pro-life movement gain from Plan and its work as it continues to grow?
Well, as a former nurse who comforted an abortion survivor, I've witnessed firsthand the vital importance of the pro-life Americans stepping up to protect both unborn babies and babies who've been born, as well as their moms. So Plan is answering the questions of what happens when abortion is not an option, when it's illegal or unthinkable, and hopefully both. And all of the pro-life activists have had their heads down for so long, working so hard to stop abortion. And we're saying that that time is drawing near. And so it's also time for us to start thinking past that. And there's going to be a lot of hard work for the pro-life movement after Roe is overturned. It'll never stop, really.
And Chaney, real quick, what regions does Plan provide help, and how can a family in need find more information?
Plan's active right now in Georgia and Northern Virginia, and you can visit our website at planforher.org. We hope to spread this model to many more states. We hope you will explore our directory of resources, and even if you don't live in Northern Virginia, we've listed national service providers on the margins so that anyone can find help.
Excellent. Well, thank you both for joining us. Jill Stanek, Plan Community Outreach Manager, and Chaney Mullins, Plan Program Manager. Thank you.
Thank you, Catherine.